ADHD look a little different in men? Happy Men's Health Month. I'm Dr. Mina Merholm, board certified psychiatrist, and assistant professor of psychiatry at Columbia, and want to dive a little bit into a couple topics this month around men's health, and one of which is ADHD. And one way that we often get surprised is that when a patient comes to me and just describes the trajectory of their life, and I look at a couple different areas of their life. One is education. They say, I was just never a good student. I never was able to take tests or really focus or really study. Interesting. But then also even relationally, they say, I've gotten just a lot of feedback from like partners, people that I've been with. It's just like, I'm like never listening. I'm never paying attention. I'm always distracted. Anytime I talk to them, I'm even rude or I interrupt them. And I don't mean to be, but that seems to be the way I sort of show up in my relationships with my loved ones or my close friends or folks who I'm dating and the like. When you combine a couple of things like that interpersonally, the viewpoint of how a sort of hyperactive presentation in a man can be growing up, oftentimes it is this rude, interrupting, not patient, getting in the way, and not able to do well in school, not able to do well at work. Well, because you're just always jumping the gun, always the first to do something, and not staying on task in one thing or another. And oftentimes what a man will think is, well, this is just my personality, right? This is a defect in how I am. But what the data tells us, what the research tells us, especially in this presentation, is that this is one of the ways that it can show up differently in men. It's a bit more aggressive, it's a bit more forward, it's a bit more abrasive even, if you will. And one of the most remarkable things in ADHD treatments, people oftentimes ask a psychiatrist, like, isn't it so depressing seeing, patients who are sick? One of the greatest things in my career is seeing someone who has been misdiagnosed maybe for a long time, get accurately diagnosed, and then a couple of days later, one patient told me it was like putting on glasses for the first time. And I can finally see, and I see that these things are not my personality, but there were things that I really struggled with. So for men's health, we're going to discuss a couple of ways that symptoms can look a bit different for men and what we could do about them. Follow along.